Hi, and welcome to Health Coaching in Clinics channel. I'm Simona Vinci. I'm a certified and UKI HCA registered health coach. Today, I want to talk about something every clinic, hospital department and doctors deals with, whether we notice it or not. I want to talk about non-communicable diseases, or NCDs, and how poor patient implementation is silently undermining care. I want to look at the most common non-communicable diseases, which doctors and departments feel the biggest impact, and why clinics lose outcomes, not because treatment is wrong, but because advice isn't followed. Non-communicable diseases, or NCDs, are long-term conditions that aren't caused by infections or acute injuries, as per se, but by lifestyle, genetics, or environmental factors. Some of the most common ones include cardiovascular diseases like hypertension, atrial fibrillation, and heart diseases, type 2 diabetes and metabolic disorders, chronic respiratory diseases such as COPD, chronic pain syndrome, nociplastic pain, for example, obesity and bariatric concerns, pre and post-op as well. Also, chronic stress, burnout, depression and anxiety are among those. Autoimmune and inflammatory conditions as well. All these conditions are hugely prevalent. In fact, non-communicable diseases account for the majority of morbidity and mortality worldwide. And they are exactly the condition most sensitive to daily patients' behavior. Here is the problem, or at least here is how I see it. Treatment for these conditions is often highly effective, and to be so effective, they often go together with lifestyle changes. Patients should follow through, but in reality, patients forget or misunderstand instructions or don't like to be told. Lifestyle recommendation feels overwhelming. Stress and emotional barriers get in the way. Old habits creep back in. Even small deviation from treatment can dramatically reduce outcome. This is where most clinics lose results, not in the clinic, but in daily life. Patients need guidance, reinforcement, and accountability between appointments. This is how I see it, at least. Non-communicable diseases touch nearly every department, but some are particularly impacted by poor patients' adherence and follow-through. Among some of them, we can count cardiology, blood pressure control, heart failure management, post-MI lifestyle changes, AF are among some, for example. Endocrinology, diabetes clinics, diet, glucose monitoring, exercise adherence during and post GLP-1 injection courses as well. And then we come to pain clinics, chronic pain departments, rehab, graded activity, adherence to pain management plans or programs. Another area is bariatric and weight management programs. Diet, exercise, behavioral change needs to be addressed even pre or post operation. Primary care, general practice, GPs face multi-morbidity management on a daily basis with unnecessary added costs. Psychotherapy, psychology, psychiatry, stress clinics, habit, stress, emotional regulation programs as well. Physiotherapy even. In each of these areas, the success of medical recommendation is only as strong as patient execution outside the clinic. Poor implementation is not just a minor issue, it's a systematic barrier to better outcomes. Poor patient implementation affects clinic in multiple ways. For example, outcomes. Suboptimal adherence means slower improvement and incomplete recovery sometimes. Reputation. Patients judge your clinic by results, not explanations. Retention. Frustrated patient may switch providers. Clinician workload. Doctors spend time repeating advice instead of focusing on complex care. Cost. Failed treatment plans increase follow-up visit, investigation, and complications. Essentially, non-communicable diseases reveal the execution gap, the space between excellent clinical recommendation and real-world patient behavior. Clinics that ignore this gap are leaving outcome satisfaction and revenue on the table. The good news though, all this is also an enormous opportunity. If clinics can integrate health coaching, behavior support, and implementation system, they can dramatically improve adherence for chronic conditions, reduce complication and hospital readmissions, improve patient satisfaction and retention, free up doctors to focus on high-value clinical work. Departments like cardiology, bariatrics, endocrinology, pain management, and primary care all benefit because these are the areas where daily patient behavior has the biggest impact on outcomes. I'd like to add that helping patients to include personalized lifestyle changes as a cascade impact, and a positive cascade impact on their happiness and their family's well-being too. Ultimately, fulfilled and happier individuals lead to a better society altogether. If you're a doctor, a clinic manager, or a GP or a department head, understanding the impact of non-communicable disease is only the first step, but I'm sure you're already there. The next step is closing the execution gap, so your patients actually follow through and your clinical recommendation is translated into measurable results. Subscribe to this channel because in the next videos I'll show exactly how a clinic can use integrated health coaching to improve patient adherence without adding workflow. Thank you for now.